Hi, everyone. Thank you so much for joining me on your Friday. And it's right before the holidays. So happy holidays to everyone. Today, we're trying a little bit of a different format. So we thought it would be super fun, especially now it's kind of busy time of year, to do basically a Q&A session. So we just put together a brief PowerPoint to just kind of stimulate those questions, get you thinking. And then at the end of this brief PowerPoint, I'm not going to spend a lot of time. I will stop my screen sharing and we can just have a conversation. We can, I can take individual questions or you can type them in the chat box. So some typical things to consider with aesthetic treatments. First of all, we always start with what's your priorities? What's the number one concern that you have? And then we like to go, or at least I like to go sort of in order of your priorities and concerns. Also your lifestyle, that could be budget, that could be downtime, that could be sun exposure, cost, of course, your time frame to getting something done. Sometimes there's a deadline, like a wedding, a reunion. Sometimes we just want consistency. And some personalities just decide once they're going to do it, they want to just do it all together. Other people like to go more gradually. Expectations are important because no one's perfect. Medicine isn't perfect. And so we have to have realistic expectations. And then, of course, maintenance of all these treatments. So here are some top concerns we see in our clinic. And I am happy to answer questions about any of these. I may not know everything you want to know, but I can certainly get back to you or make myself a note and then make a post on it or a blog on it later. In general, for wrinkles and fine lines, usually we're talking about Botox and other neuromodulators, fillers such as Juvederm, Restylane, biostimulators such as Radiesse and Sculptra, and then, of course, laser resurfacing such as Fraxel, Clear and Brilliant. Sometimes we include IPL in that too. So here's an example of a Botox before and after on the forehead. And then we have volume loss. So volume loss is responsible for everything coming down and making the bottom face heavy and jowly, making the neck look thicker and wrinkly. And so for this issue, we oftentimes talk about soft wave, fillers, and laser treatments. So a few before and afters. This is after Radiesse. This is a biostimulator, so it has filler effects. And then we also stimulate collagen. So hyperpigmentation or brown spots is very common here these issues are very common here in Arizona, anywhere really where there's sun. So we have so many different modalities. And again, we kind of tailor the treatment to fit all your needs. So chemical peels, laser treatments, and then of course, medical grade skincare and SPF are super important mixed in there. Here's an example of some texture change and brown spot changes. This was after Fraxel. And then over time, the skin gets thinner. So we have things that we can do to prevent that and reverse it a little bit. And those things include medical grade skincare, especially retinoids. So like tretinoin, which is prescription strength retin-A, retinol, collagen boosting treatments. So lasers, microneedling, and then again, going along with medical grade skincare, antioxidants, SPF. So another before and after of thinning skin, and let's look how the skin looks nice and thick in the after picture. Also commonly asked about under eye bags and dark circles. We typically use great skincare and eye cream, at least one eye cream for our patients, and then we can put filler underneath that area to help with the dark circles and the volume loss. And then we can also use energy-based devices or microneedling to thicken the skin and improve the skin quality, strength, and therefore reduce the darkness underneath the eyes. So here are some photos. It might be a little bit difficult to appreciate on the screen, but we got some really nice before and afters of an improvement of sagging underneath the eyes and dark circles underneath the eyes. Of course, pores can be the bane of our existence. They're extremely hard to treat, and they happen to everyone. Our pores get bigger over time because our collagen is getting looser over time, but we do have many things that can improve them. Here is someone who had one Fraxel treatment. You can see fine lines are improved, sun damage is better, the pores are smaller. This one treatment of Fraxel. And so many people ask about the neck and décolleté. So we have multiple different modalities for that. And I think a multimodality approach is best in this area. I've talked about this before. So let's thicken the skin with chemical peels, medical grade skincare, microneedling. We can tighten with ultrasound and radio frequency. We can thicken the skin and tighten with laser. And we can do these things with these different modalities and get a better result than just doing one modality. So here's someone who had an IPL treatment on her neck and décolleté. And you can see how after just, I think it was one treatment, it may have been two, just one or two treatments that can make such a big difference in the brown spots and also just the glow of the skin. Thinner and even lips are a common concern, and this can be in patients of any age. So it's more common now than it used to be to fill lips, and believe it or not. And we fill lips from anywhere in someone's 20s, believe it or not, to someone's 80s. And we at the practice take different steps, use different products, and use different techniques based upon someone's age and anatomy. So that's really important for a natural look. And that's our number one goal here. Well, safety is our number one goal, and then a natural look is number two. So we can make someone's lips more symmetrical. We can make someone's lips look more hydrated. You see in the top before and after, I addressed the lip lines of the patient. You see in the bottom lip, that's a younger patient. She wanted volume and hydration. So you can see the little tiny lines she had, especially in her bottom lip, are smoothed out after treatment. So lip treatment is really, really tailored, and most people have a little bit of minor asymmetry in their lips, and we can help with that too. Hair thinning or hair loss. So we use different things for that. We often prescribe medications. We use topical solutions, and we inject PRP. Those are three most commonly used modalities in our office, and we have success with all of them. So here's an example after PRP injection. So neck fullness, so double chin or fullness in that area. Believe it or not, we have multiple minimally invasive procedures for this. When I was training 15 or more than 15 years ago, actually, we had nothing that was non-invasive or minimally invasive. Liposuction was the only way. Now we can simply inject a liquid, which is Kybella. It's a detergent that will safely and effectively get rid of fat. We can completely non-invasively just apply an applicator here and freeze the fat off with cool sculpting. Or we can use laser, ultrasound, or radio frequency to just minimally invasively tighten and melt the fat. So it's pretty cool how far we've come in a short amount of time. And here is, this is from Allergan. This is not our photo, but here is an example of Kybella, the detergent that's injected into the double chin area and can make a huge difference just by treating that area. Broken capillaries and redness is very common to occur over time, but it can also happen in younger patients too, because it can be genetic and hereditary, and it's very commonly asked about in our office. We have several different modalities. We have medications. We have this laser called the V-beam or V-beam Perfecta laser, which is a pulse dye laser, and we have IPL, which can also treat brown. So the IPL can treat red and brown. So here's an example, before and after, broken capillaries and redness. All right, so here is example of some FAQs, but before we get to this, we kind of put these in just in case we run out of questions, but hopefully you have some questions to ask me. I would love to answer them. So before we get to that though, thank you so much for attending. You will each be entered into a raffle to win a Diamond Glow and the Skin Medica kit. So this is your fun little prize that you are entered to win. We'll be contacting you on probably not next week, but the week after if you win. So after the new year. And here are your specials that you are invited to take advantage of. Because you attended this webinar. So we have Tighten, we have Glow, and we have Renew. And so the Tighten is soft wave of the face and neck. And then this product that we love, it's a retinoid. It's alpha ret, it's a retinol. So it's gentler than a prescription strength Retin-A, but it works very, very effectively. And I like to recommend it for face, neck, and chest, believe it or not. So that package is $3,000 and you save $700. As you know, I love the soft wave for lifting the head, or sorry, lifting the head, lifting the face, the brows, the cheeks, and the jowl area. And then it really does a nice job of tightening the neck as well. The Glow package this is one of my favorite treatments to recommend. This is done with our estheticians or Maya, our nurse. So this is IPL and Clear and Brilliant. So this is the Clear Glow treatment. And then we're also going to throw in an Elastin Illuminate, which is a non-bleaching skin lightener. So it helps get rid of the brown spots, helps get rid of actually red and brown. It's a great exfoliator. So you do the IPL and then you do the Clear and Brilliant. You can do them in one session, and doing these two things together it's kind of amazing actually, because they're very easy to do, minimal downtime. It will help get rid of a lot of brown spots, and it will help with skin texture, and the skin literally just glows afterwards. And then finally, our Renew package, it's the perfect peel. And then my very favorite my very favorite product, which is Skin Medica TNS. I use this on my face, neck, and décolleté every day. I wish I could bathe in it. It just makes such a difference. So I just use it once a day. And so basically the perfect peel will peel off imperfections and brown spots, and it will tighten the pores. You do get peeling for 5 to 7 days. And then the Skin Medica will give you this amazing glow, and it has growth factors in it to stimulate collagen. The cost for that is $500. You are saving about $200. Sorry, I forgot to mention, cost for the Glow treatment is $1,000. You're saving $400. So thank you so much. I am going to stop sharing my screen. We will send you, ooh, that's close. We will send you, where is my filter? We'll send you an email reminding you about those specials, and you can take advantage of them until Monday. So we do have our office open on Monday. We will be accepting calls. And of course, you can email us at any time. So anytime over the weekend, email, text, or call us. We'll not return your call on the weekend, but on Monday we will. Okay, guys, I'm hoping you have some questions. So let me just go to the Q&A here. Is there an offer for gift cards for the holiday? Well, unfortunately, Jen, we don't. We just had one for Black Friday, and it's such a success and such a great deal. We are only able to do that once a year. But thank you so much for asking. And remember Black Friday for next year. I'm not guaranteeing we're doing it, but we probably will. Okay, so an anonymous attendee, talk a little bit more about under eye bags. How long do treatments typically last? I love that question. So we have several layers of treatments here. We have one that's more preventative. That's the eye cream. So the eye creams are more preventative. And that's something that it doesn't make a huge dramatic difference now, but in like 5 years or 10 years, you're going to be so happy that you started using a medical grade eye cream. Highly, highly recommend. Super important. Not going to be a game changer for how you look tomorrow. Then we have filler. Filler under the eyes lasts at least a year, but in reality, for most patients, it will last much longer. It can last 2 years, 3 years, even longer than that. We try not to put filler underneath the eyes very frequently because there are so many other ways we can improve that area by lifting the cheeks, etc. But filler there will last at least a year. And then the skin tightening procedures like microneedling, Fraxel, Agnes, which is our radio frequency device, those treatments will last a long time because for years, because they are stimulating your collagen. And collagen is the most permanent of all the anti-aging treatments. It's just that we continue to age at the same time, and collagen eventually does break down. So I don't like calling anything in cosmetics permanent, but the longest lasting things you can do are things like the microneedling, the clear and brilliant, the Fraxel, and radio frequency. Out of all those things, radio frequency is most dramatic. And for maintenance, maybe you would do a treatment every 18 months, if ideal case scenario. What does the Fraxel do for lasers? What does the Fraxel laser do for wrinkles? The Fraxel will help to tighten the skin by producing collagen. So basically the light is going into the skin. So laser uses light as an energy source. The light goes into the skin and it heats the skin as it's absorbed. It's absorbed by the water in the skin for the Fraxel. And because of that, it does a really nice all over heating of the skin. And that stimulates your skin to produce collagen. And then the collagen will make the skin tighter. It just kind of sucks everything in, improves the texture. And when you improve the texture, the wrinkles look better. Now, if somebody has like forehead creases across, the Fraxel can help us a little bit. I just saw someone today where we saw a nice improvement of those forehead wrinkles. But the best treatment is going to be Botox because Botox directly will inhibit the formation of the wrinkles. So it's a little bit more of a direct approach. But that being said, sometimes people are absolutely against injectables, and the Fraxel can help in a way for the lines. Diane asks, what treatments would you recommend along with an annual Fraxel? Example, Clear and Brilliant and IPL. I am so glad you asked. Okay, if I could answer this in a very real world answer where I am thinking about budget and I am thinking about lifestyle, but you're not limiting me too much. I would say one annual Fraxel, and then in 6 months, approximately, you've got to take in consideration the summer, et cetera. But in about sometime before your annual Fraxel, you do one treatment where you do an Clear and Brilliant and an IPL together. And we call that what do we call that? The clear treatment, something like that. But you do them together and you save a little money when you do them together. And if you do that halfway through, you will have beautiful skin forever. And it'll help take care of your brown spots, texture, etc. Okay, anonymous attendee. Should we see you for thinning hair concerns or someone else in your office? I love that. So I mostly treat patients with PRP. So that's injection of the body's own growth factors. It's so cool. It's like science fiction, but we take your blood and we put it in a centrifuge, and then we extract the part of the blood that has the most growth factors. Those come from the platelets in our blood. So we take that part of the blood and I inject it into your scalp, and those growth factors, they're your own growth factors. They're stronger than any growth factors out there, any synthetic growth factors. They will make your hair grow. It doesn't make all hair grow. The more recent the hair loss, the better chance of success we get. But it's really a cool technology. If you are looking for a more medical regimen, like a prescription, Dr. Yonan is a great person for that. Dr. Pearson, any of our PAs, we would love to see you. But we can cover all the bases in the office between all of us. Next question. This is actually, excuse me a second. This is from Instagram. What is the best lip product for dry lips? Well, topically, I love this product from PCA. What is the name of that product from PCA that we recommend? Lip Booster. This product, it's a hyaluronic acid from PCA. It's Lip Booster. Love it, love it, love it. If you want to be as basic as possible, I love Aquaphor. Just plain Aquaphor. Do not use chapstick, in my opinion. And you can reapply that several times a day. The PCA product looks a little bit more like a gloss. It kind of plumps the lips up a little bit. So I love that one too. If you want the kind of best working lip hydrator, actually, I love using a product called Redensity in the lips themselves. So it's an injection, it's filler injection in the lips, but it doesn't volumize a ton. It will mostly hydrate. So it makes the lips look really smooth, really soft, very natural looking. It's what I have in my lips. And it really works great for hydration. I've done that for patients who have chronically chapped lips, and it has a pretty good success rate. So that was from Instagram. Let me go back to, is there a particular laser type to diminish wrinkles? The best laser to diminish wrinkles, if you want me to just answer across the board, is traditional CO2. And usually we do not do traditional CO2 in our office. Usually a plastic surgeon these days would do that for you, because most people go under general anesthesia and are out when they have the laser. It does have risks. It has much higher risk than the lasers we do in the office. Risk of infection, risk of scarring, risk of pigmentation change. So you can have little splotches of pigment, of white spots, and the pigment will not come back. Or there's this thing that can happen in fair individuals where patients lose their coloring and they lose a lot of melanin in their skin, and they get this porcelain doll look, and the skin doesn't quite look real, and it's just kind of an odd look. So anyway, that's really why fractional lasers were invented. So now you can do fractional CO2, fractional erbium, which is the Fraxel, but unfortunately, the Fraxel laser or the fractionated lasers just are not as good at wrinkle reduction. So I would say for wrinkle reduction, if you don't want to do injectables, you would do a traditional ablative laser, which is CO2, or traditional erbium, which works a little bit less than CO2, but still very effective. What do you recommend for the chin line? So I'm assuming you mean this, which in medical terms, we call the mental crease. And we can actually put filler in that area. And there's several different techniques. I would need to see your chin line, but the two most common techniques, I mix and match them. I tend to do both. We do deep injections under the mental crease there, and then I can do superficial injections with a different filler to smooth the top. So we're treating the bottom layer and we're treating the top layer. It's very, very gratifying to do, and we do it all the time. I have hair loss from losing 50 pounds. Congratulations. That's amazing. for this kind of issue, what treatments tend to be best? Well, the good news about hair loss from losing a lot of weight is that it tends to be a type of stress response. And so stress response from regarding hair loss is temporary and the hair will come back, but it's going to seem like it's coming back very slow and it might make you a little paranoid. So sometimes people get a little paranoid. They're really feeling like the hair is not coming back, or it's not until that time that they've noticed that their hair is thinned over time, which is normal. We start thinning, our hair starts thinning in our 20s, and the hair itself gets a lot skinnier. And so it looks like we don't have as much hair because the hair shaft is just getting thinner. And so sometimes we don't notice that till we have stress-related hair loss. So to answer your question, you don't have to do anything. It will come back on its own. I would absolutely make sure you're getting all your nutrients, because if you've lost that many pounds, you may be nutrient deficient. So make sure you're taking a multivitamin, eating well-balanced diet, etc. And then just make sure you're up to date also with your medical stuff. For hair loss, we usually think about thyroid, we think about anemia. So make sure you're up to date with medical exams. And then finally, if you want to do something, you could do PRP injections. We have seen that speed up the hair regrowth. You could start some topical or oral minoxidil, that's Rogaine, over the counter. You can get it at Costco, you can get it at Sam's, let's see, I think that's it regarding that. Will Fraxel also remove AKs? So AKs are precancerous spots, and they are caused by the sun. It's extremely common here for us to get these precancerous spots. And the problem is, well, I would say the good news is they're easy to treat. We often spot treat with liquid nitrogen. This is where I get my 2 or 3. And sometimes we use a chemotherapy cream, but we can use Fraxel laser. So Fraxel actually makes your skin healthier, and it removes actually a majority of precancers that you have on your skin at the time we treat you. It will not prevent them forever, but it probably reduces the amount you're going to get. It removes the ones you have. And we also know from recent literature that doing Fraxel laser regularly will decrease your chance of non-melanoma skin cancer. So it reduces your chance of basal cell and squamous cell skin cancers. So I love that question. Thank you for asking. Here's a question from Instagram. I have been getting this question so much recently. Do you recommend red light therapy, and what mask do you recommend? We actually sent out a little blurb. Haley, our PA, wrote a beautiful little blurb about this in our last newsletter. But red light therapy has some good evidence behind it, but most of the evidence has come from the lab so far. And because the red light therapy, there's really no standardization right now. So in other words, the companies kind of decide like how many lights there are, how strong the lights are, etc. And so we don't know which brand works the best. The really good science-based products, it's so great they're doing science, but of course they're only studying their own brand. So they're trying to show you what they have is effective, but they're not putting it head to head against another brand. So that's a difficult question to answer, but in general, yes, I recommend them if you have realistic expectations. So it's not going to do a huge amount for your skin. For instance, coming in and having a microneedling treatment is going to do more for your skin. Having a clear and brilliant treatment is going to do way more for your skin. Having an IPL will do more for your skin. But if you want to do something at home and want to do something that's helpful and not harmful, I think the red light is a good option. In terms of brand, I have looked at the brand Omnilux, and I think their studies are, decent, but I haven't used them personally, and I have no affiliation with them. So I can't tell you for certain, but that does seem like one brand that's decent. Let's see. What do you suggest for a somewhat sagging jawline? I love this question. I think it's so cute that you said somewhat sagging. Um, so I'd love to see a picture. Um, I think, but it actually does give me a good idea because it's not like, you want a facelift, you just want something that's going to help to pull back. So we have several options. I think the easiest thing would be to do some filler back here in um, the jawline. So we call this the ramus of the mandible is the anatomic term, but we can strengthen the jawline and it pulls back and it pulls from this area. Sometimes people get very hollow in this area. Patients who have had facelifts are very hollow in this area, but sometimes very athletic people will also be that way. And so I can put something here. Usually I'll use a biostimulator like Radius or Sculptra, builds collagen, and it pulls back like this. So we're just giving some more support. So this is very smooth. If you don't want to do filler, we can use energy-based devices. So I like radio frequency, the Agnes specifically. I like the Agnes device for this because if there's extra fat or tissue in this area, I can just diminish that a little bit with one setting and use another setting to tighten the skin. And I'll tell you what really works best is if you do both. You tighten the skin and then you put a little bit of filler under the skin. It's amazing because you're just, again, using two mechanisms of action to treat your concern. Oh, I just read a little private message. Thank you so much. And I can't wait to see you. Anybody else have questions? Anything from Instagram? Okay. I think this has been so good. I've had so much fun answering your questions. I hope I answered them in enough depth. And for whoever asked about the red light, stay tuned on that because there is more and more data coming out on that. So I'm really excited to keep reading up on that and reading the latest journal articles and then the latest data put out there by the companies too. So hopefully we'll have an update for you somewhat soon. All right. Well, I will see you soon. And thank you so much. Happy holidays, everyone. Be safe. Have a wonderful, restful time and see you in the new year.